So let's talk about providers. So there are different providers that you can have if you're having a baby. I mean, period. But if you're having a baby, there are options that you have about where you can have your baby and who can help you. So depending on what state you're in, you can see a midwife. And I mean, you can see a midwife in all of the states. However, there are certain states that don't allow midwives who aren't also nurses. So, certified practicing midwives, CPMs, um, versus CNMs, which is a certified nurse midwife. And I think it depends on like where they can go as far as whether they're in the birth center or at home. There are some birth centers that only hire certified nurse midwives, and it depends on what you feel comfortable with, because the certified practicing midwives, or certified licensed midwives, they have studied extensively on how to be a midwife. They aren't nurses, but they can still give you like your pitocin, like if you needed pitocin after to control hemorrhaging and anything that you'd really need a midwife to do, but they don't have that extra layer of medical training. And nurse midwives they were nurses first and then continued on to become midwives. But I really wanted this to be more about like the locations, because a lot of people think that the only place that they can have a baby is at the hospital, and that's just not the case. If you are a low risk person, a low risk pregnancy, then out of the hospital is as safe, if not safer, than the hospital. Considering out of the hospital, you're letting your body do what it needs to do, and there's less monitoring, because it has been shown that continuous fetal monitoring doesn't improve outcomes. It can also sometimes lead to cesareans, because there might be deviations that would not have been picked up but are actually normal for your birth and your pregnancy as long as you're low risk. Intermittent monitoring or auscultation has been shown to be just as safe, if not safer. And it's less stress. So if you're out of the hospital and you're at home, most people are going to feel more comfortable. They're going to have their blankets and their pillows and the smells that they're already familiar with. Their smells of their family. You can have your dog if your dog is comforting to you. If you want your kids to be present, or if you don't want them to be present, you need to have someone to just make sure. But at least it would be normalizing birth for your family. But some people, that might not be the route you want to take. I, at that point in my life, was not ready for a home birth. The birth center is where I needed to be, because we do live in a multi-family home. And multi-generational, it's the same family. But I wasn't ready to be here at that point. But I did want to be out of the hospital after my first baby, even though that birth was great in its own right. I did want to have that out of hospital experience, especially having experienced birth before and knowing really what I wanted to do and having no fear going into birth. But yeah, home is great if you would like to be home, but if you have certain circumstances, if it's about the cleanup, don't worry about the cleanup. Your midwives and birth assistants are going to, and probably doulas, are going to help you clean up anything that needs to be cleaned up afterwards. That's not your job. You're fine. Plus, you don't have to travel anymore after you have your baby. And if you are seeing a home birth midwife, chances are they're going to have your appointments postpartum at your home as well. Which is it's easier as far as traveling goes, and it's just a safer, calmer environment for just the mind and the heart. But birth centers are a great other option, especially if you want to be able to have the option of using nitrous. So a lot of people don't realize that nitrous is an option for pain relief during labor. It is the only proven safe method for baby of pain relief during labor, because it gets out of your system so quickly that it doesn't really have time to affect the baby in labor. Whereas other methods can pass through the placenta and make baby sleepy or tired or have labored breathing. But that's for hospital births, not home births or birth center births. So birth centers, you have that option. If you don't own a giant, comfy, awesome tub, but if you're having a home birth, you can rent tubs. But birth centers already have them, and it is also slightly removed from your house. And the things that you might be like, oh, I have to take out the trash, or I have to do this, or I have to do that, things that might be like bothering you. It's almost like going to a hotel to have your baby. It's very nice, most of the time it's pretty cushy, and it's another really great option to not be in the hospital. And they have all of their tools and everything they need there, and a lot of times they have diffusers. If you're having a doula, then generally it's just everything is like needed there. Everything's cohesive, and if you have a doula that's experienced in the birth center you're going to, it's like they're used to that spot. It's just something that can be really great. And all birth can be amazing. Hospitals can be just as awesome. And especially if you're someone that gets really anxious about medical complexities happening, if you are thinking about all of that and it's just a little bit too much, or if you are high risk, you can still have the experience of home birth or birth center birth and just literally use the hospital as the place to facilitate. If you are going that route, I would recommend having a doula. I mean, I recommend having a doula for anybody, not just because I'm a doula, but because that level of support and advocacy is just so important. It really makes the difference in how you perceive your experience, whether it went as planned or if it went differently. Having that connection with somebody and that support during one of these really intense experiences makes the whole thing. So if you are having a hospital birth, you need to know your options and the different things that can happen. You can also be seen by a midwife at the hospital. Generally, they're overseen by an OB. Some family doctors will also deliver. As long as they have basically rights at the hospital, then you can deliver. You will have to advocate. There are things that are hospital policy that like different hospital. I'm not going to say like speak on all hospitals, but most hospitals want to do a cervical exam upon admission. I have had clients who refuse that, and if you're having a baby, you're having a baby, and they can see that even if they don't necessarily love the way that you're going. But some people are like, yeah, I want to know exactly where I'm at. I want to know how much progress I've made. And that's fine. And they might want to hook you up to monitors. You do not have to, if you are low risk, you don't have to, you don't have to do anything. That's your choices if you make informed consent or not. Because if you have all the information, you can choose to do an informed refusal to whatever procedures you feel you need to. They might have you sign basically a waiver saying that, hey, we informed this person, but they're still choosing to do this. They might have you sign waivers, but at least you'd be able to make your choices. But there are things that are hospital policy that are not law. People don't realize you have the right to say, no, I don't want a cervical exam. And if someone tries to continue to do a cervical exam, stop them. It's not okay. And that's also another reason why a doula is super important, because a lot of times partners don't necessarily know, like, hey, like the doctors have to do this thing. It's like, well, this person said no. I don't care what they have to do, get your hand out of or away from a client. Yeah, sorry to go there. It was really intense, but it's something that does happen, and people don't realize they have a right to say no. And about any touching on your body. And especially if you are someone who is a survivor of sexual trauma, let your nurses know, let your doctors know, even though everyone should be treated as if they were, because the consent matters. But that's a soapbox I will get on another time. But anyways, talking about how hospital births can be really awesome. Can you tell I've heard some stories and seen some things? I have also seen some really, really amazing hospital births, including my own with my son. It just depends on how you're supported and how confident you are in certain things, and just holding boundaries. If you know you don't want an epidural and you want people to stop asking you, because it's very, very common for them to either forget or just be like, are you sure you don't want an epidural? Now would be the time. The anesthesiologist is going to leave the floor soon. tell them, don't ask me. Or put it in your chart. Say, I want it noted in my chart that I'm asking everyone to stop asking me if I want an epidural. If you ever have a moment where you feel like you're not being heard, say, I want it noted in my chart. Blah, 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 whatever thing that you really, really, really want them to listen to. Because if it's noted in your chart and they keep asking, then it just, I feel like they won't keep asking if it's in your chart. Also, some hospitals do have water birth tubs, and some people will let you labor in the tub and not let you have the baby in the tub. And there are also lots of cool bars and stuff. Well, it's like one bar, but you can put it a few different ways for pushing if you still want to be in the bed. If you have an epidural, there's just different things that we can do with the bed while you're still being in it if you have to be in the bed for an epidural or a catheter or something like that. Yeah. But there's different options, and people just don't always know all of the options, and I am here to support you. So if you would like to leave a comment, if you have a question, I will answer it as best as I can, and if I can't answer it, I will do some research and then answer it. My goal is to really just help everyone have the birth of their dreams and the experience of their dreams, even if it ends up not going to plan, which is why I don't use the term birth plan when I'm talking with my clients. I use birth vision because birth dream sounds nice. I might switch it. Dream birth. Because things don't always go according to plan, but you can dream and you can hope and you can prepare for all of the things that you can control. And it's my goal to help you and all of my clients and anyone that I really serve have all of the information that you need to have your dream birth and feel supported and loved throughout the whole process, because you deserve it. Wait, and if you want to see more birth content or any like positive and inspiring messages or random things that I have figured out as a mom, subscribe and you'll see all that stuff. So thank you for watching and have a beautiful day.